Welcome back. This lecture, we're going to get started talking about moving and handling. And this is going to essentially kick off what I'm calling our review week. So we'll have this information, and then we'll have some non-textbook information talking about vital signs, cardiac cycle, coding, charting, documenting. So we'll get into a whole bunch of areas that are going to build off of our first couple of chapters. So communication is the center of all things that we do. So when we're talking about moving and handling, communication plays a big role in that, because we need to communicate effectively to our patients to get them to help us as much as possible, because ultimately all the wear and tear that we do on a daily basis is cumulative. It all adds up. So the better we can communicate our needs to our patients, the more they can help us, and the more that means that they can actually help us as far as our own physical health. When you look at that as far as kind of the other concepts that are intertwined, thinking about charting and documenting. We are the individual that sees our patients. Our radiologists typically are not involved with our patients unless it's a gastrointestinal type of study where their physical presence is perhaps required for an examination. So they're relying on sound notes, sound documenting of everything that we're pulling out of the patient. So our ability to grab that information ties back into that effective communication. So I'm sure you get the idea that all of those patient factors and communication techniques are going to tie into essentially the rest of the chapter, and how that's going to unfold into the individual modalities in the coming weeks. In imaging and therapy, moving and handling of patients is an everyday task. Depending on your workplace, you may have more ambulatory patients than non-ambulatory patients, or you may have vice versa. You may work in a trauma-based facility where you're having a lot of moving patients from point A to point B. But nonetheless, this can wreak havoc on our own physical selves, especially our back and our shoulders. So when we think about what we're doing, we always have to think about protecting ourselves to prevent any form of injury. So back pain, neck pain is said to affect as many as 80% of adults at some point. And now the textbook didn't specify whether that was acutely or chronically, but the fact that it kind of hits at some point, I would say it's probably acute. But chronic conditions are known problems in the medical imaging field because of what we do, because of the requirements that we have to move our patients for specific positions, projections, procedures, and just it's repetitive, so it all adds up. And musculoskeletal strain, or MSK strain, is said to cause more time off than any other condition. So, there's a lot of costs that are associated with back pain, muscle pain itself, and it's cost to our employers in terms of time off. It's cost to the medical system in terms of utilization of services. It's cost to ourselves. And this cost to ourselves is definitely a progressive development of issues. It's usually not just one circumstance that leads to our issue. It may be that one patient that becomes the tipping stone from years of damage that we've done, from improper technique to cutting corners and hustling through things and doing things on our own. It's all progressive, and it's all causing damage. So we have to think about how we can do things differently through additional training, through utilization of additional staff and specialist types of equipment. Ultimately, I want you to feel like yellow man over here, and definitely not like red man over here. So you may in fact be blue guy over here. I don't want you to get any worse than blue guy. So we're going to talk about some different exercises that can be intertwined. We'll talk about some different techniques, just a few of them. You do this on a daily basis, but I want you to start to focus on how you can do things a little bit different to, in fact, protect ourselves. So to talk about the spine itself, this is truly a review. So we obviously know the components of the spine, so I don't have to spend time saying, look at the cervical region, look how the ribs connect at, to the facets throughout this thoracic region. I don't have to explain all of those types of things, but I'll hit on a couple different points as far as kind of the overall structure of the spine itself. Of course, its role is essentially stability of the entire body, but also to protect the spinal cord, of course. So the spine itself does have series of curves. So you have a concave curve of the cervical spine, convex curve of the thoracic spine, a concave curve here of the lumbar spine, and then you can see how it curves back out here at the sacrocoxal type of region. So at each of the joints, though, so where each of the vertebrae meet, nerve roots do exit at those points. So nerve types of damage can create feelings of numbness, can create feelings of pain. It just depends on how perhaps the disc is maybe the disc is damaged, maybe it's herniated and protruding onto the spinal cord, that type of thing. So different types of damages can take place, but of all of the vertebra, the one that has the most movement, you may think of the neck. I think the neck's maybe truly the most flexible, but it doesn't change a lot when we go from one position to another position. As far as what's the change in the neck from standing to sitting? There isn't much of a change, but because of the rock of the pelvis, when we're going from one movement to another movement, there's a lot of manipulation that takes place there. So you tend to see a lot of damage that takes place in the lumbar spine first, and then of course the cervical spine next. So both concave curves are issues, and both of these curves are also secondary curves. They're not present at birth, whereas this curve is and this curve is. So kind of interesting how that works, but essentially those are the areas that injury can take place. Disc itself is considered to be a shock absorber, so to release a little bit of that energy that's placed on our bodies. The disc itself does not have nerves or blood supply, but it has two primary components, and I really like the names of both of these components. So the outermost component is called the annulus fibrosus, so it's a little bit tougher. The innermost component is called the nucleus pulposus, so it's kind of like a jelly-like substance. So when you have a herniated nucleus pulposus, if you would, slip disc, herniated disc, what happens is that soft gel-like substance actually protrudes out and can impinge against those nerves and create certainly can create some pain. The disc itself is sponge-like. It's most effective when it's nice and hydrated. When it's nice and full and nice, has a lot of nucleus pulposus and kind of like a nutrient-based, water-based content, it can maintain its form. It can move with the body, move with the spine as it's moving. But as it loses its hydration, issues can start to happen. Muscles itself are certainly there for additional stability. They're really lining the spinal column as well. So different muscles for different regions, of course, but as we arch our back, our muscles become shorter and stronger, but as we lean forward, our muscles become longer and weaker. So the more we lean forward and the more we overextend ourselves, the more vulnerable our body positions can essentially become. So it's just not all about body mechanics, though, as far as what is a contributing cause. Our level of fitness has a dramatic effect. So the stronger we can keep our cores, the less back pain that we're actually going to have. So physical fitness certainly is going to be key. Making sure that you're obtaining a sound nutritional diet, so you're avoiding drinking and smoking. So alcoholic beverages, tobacco-based products can be contributing causes. But then, of course, the lifting techniques, how we're actually moving and handling our patients, whether we're taking shortcuts because, our peers are saying, hurry up, we got to get this done. We got to move this patient to the next department. We have 6 requests sitting here and we don't have time. Let's go. Just stress from the job, demands of workflow, those types of things can cause those shortcuts to take place. But when we think about those shortcuts, we're really just shortcutting ourselves essentially, and that can lead to long-term damage that really our employer may or may not invest back into us. So not something that you want to deal with. I personally deal with lower back pain, lumbar pain from a motor vehicle accident about 3 years ago. I like to think that I'm, too young to be in this much pain, but it happens, and you have to find ways to overcome it. So if you don't have the back pain right now, thank yourselves, and just continue to hopefully apply sound techniques, avoid the shortcuts, because long term, certainly there can be big ramifications, and not something you really want to deal with. So I talked to you about HNPs, herniated nucleus pulposus, or slip discs before, so you can kind of see a little bit of information there. In the lumbar region is most common, so you can see your L5, L4, L3, L2, L1, so on. Muscle strain, it definitely is a big problem, can take up to 6 weeks to heal, and that's with appropriate care. Employers are not going to give us 6 weeks off typically, to heal. So keep these types of things in mind, is that when injuries happen, we've got to take care of ourselves. So try to take time off, as much time as you can possibly get off when injuries do happen. Ligament damage typically can happen from improper techniques. So sudden or excessive movements, torquing, twisting, wrenching types of movements, not paying attention as far as, keeping your feet and your core going in the same directions, and not locking your feet and just turning your core type of thing. So it's all about awareness and just saying, all right, I have to be as purposeful as possible in every movement that I make. The damage to the facet joints, you may be more familiar with those being called the zygapophyseal joints, Z joints I like to call them, can also be serious issues, largely because of damage to our intervertebral discs. So when those discs become damaged, you got to think that those vertebral bodies, and really the whole vertebra itself, they're relying on those discs to maintain their position, to make sure that there's nice articulation between those two. The upper, we'll say it would be the upper inferior articular process and the lower superior articular process, meaning to form that facet joint. So when the disc degrades, when it starts to shrink, there's inevitably going to be shifting at that joint space, and when that joint space shifts, partial dislocations or subluxations can happen. It can start to degrade the articular cartilage that's found within that joint space, and when it degrades that, it's going to lead to some arthritis, which can subsequently create some pain. So all of these things are cumulative, so we have to make sure that we're maintaining proper technique to keep our backs as healthy as possible. The textbook, of course, does talk more about how progressive European laws are, and how they appear to be extremely employee focused, which I think is incredibly great. Of course, we have laws here in the States that are also employee focused. I think there are, quite a few OSHA based guidelines out there that employers are required to follow and comply with. Of course, they are responsible for actions that happen within the workplace, working environment. But there were some really interesting ones. So I encourage you to read through them. As far as there were weight-based restrictions as far as manual lifting that could take place, and I think that's great. You have to make sure that we as employees are protected by our employers. So, equipment must be provided by the employers, but we have to make sure that we're using equipment effectively, that we're going through the training, we're applying that training effectively as well. So I think, it's the laws themselves are interesting. I don't want you to put a whole lot of weight in, the European laws in comparison to, the laws that we're bound by here in this country, but still are interesting though nonetheless. Ultimately, regardless of whether it's a federal law, a state law, or some type of compliance piece from an accreditor like the Joint Commission, or it's just an internal health system based policy, all decisions that should be made should encourage and enforce safer handling. And we should really avoid every unsafe act possible, with the exception, of course, of any type of life-threatening events. You're in the moment at that point. But for on the routine basis, we should be having every safe act possible. And by allowing the patient to be as independent as they can be, it's both better for the patient and it's better for us, especially when you think in terms of patients that are just out of the OR, patients that have been in the hospital recovering for 2, 3, 4 days. Independent movements are a part of this strengthening and healing process. So the more our patients can help us, the better. So we need to encourage our patients to assist us. We just need to essentially slow down in our movements. Know that if we're taking shortcuts, if we're moving too fast, we may cause some serious long-term unavoidable damage that may be irreparable as well. You understand, we work in the medical imaging field. We understand that back surgeries are not always the most effective type of mechanism. They may not cure the pain. Some, in fact, make the pain a little bit more amplified. So, our back should be a sacred a sacred body part for us. So we got to keep it safe ultimately. So if we have appropriate aids, as far as lift assist teams, or if we actually have positioning aids to kind of help us with that manual process, the more we can use, the better. Part of any risk management process should be to identify hazards and any risks that they may carry. Well, what we're talking about right here, as far as moving and handling of patients, does carry risk. It carries risks to the health-based system. If we're injured on the job, that is their responsibility. But it creates risk for the employees as well, as far as long-term irreparable types of potential damage. I really like they used the idea of what I'm calling the elite tactic. So environment, load, individual capability, task, and equipment. So environment is essentially understanding the limitations of the room and the space. Load is to understand what you're trying to lift, so essentially the weight of the object or the weight of the patient, the weight of the body part. Identifying your own individual capabilities, so can we lift that? Thinking about the task at hand is, how long do we have to lift it? Where do we have to lift from? Is it, just from point A to point B? Is it, all over the place? So, thinking about what we're actually tasked with is an important consideration. And, if there's any equipment that's available to assist us, we should be applying that equipment to help as well. So I kind of like that idea, something to consider, I think, at all points. So, it's nicely spelled out, elite. I don't know if they wanted it to, be an acronym, but there you go. Follow the elite when you're thinking about manual handling whenever possible. Now, the first consideration when moving and handling a patient is the load of the patient, what you're actually having to physically move. Are you just moving the patient's leg? Are you just elevating it, or are you moving the patient from the stretcher to the table? What is trying to be accomplished? The textbook kind of gives a pretty cool little analogy about a box. So saying and indicating that essentially, if you have a box, you can move that box, completely from point A to point B. But inside that box is made up of a whole bunch of individual components. So then if you can, move each of those individual components, you can lighten the individual load, of course. When you think about that and you apply the box analogy to a patient, essentially we can move the whole box ourselves, or we can have ourselves in an assist team moving that box, or we can have ourselves and the patient themselves having to move some of that box. So the more you can encourage the patient to help, the better. You move some, they move some, and taking the time to explain what you need is going to help to better facilitate this process. So be kind, be gentle, be compassionate to our patients, but they need to be helping us as much as they possibly can. So, which sometimes they can't. So let's just face it. Sometimes the situation precludes them from helping us indeed, but certainly there are other strategies out there than us having to move that patient completely by ourselves. So with anything, try to pre-plan things out as much as you possibly can do. Think through the movement. What barriers are you going to have in place? What do you have available to help you? Are there any types of movement type devices? Are there any slide bags, transfer boards? What is available? And then secondly, what is the best approach? So a mini brainstorm, for 5-10 seconds is really probably all that's necessary, but it is necessary. So think through it, think why it's necessary. You got to protect yourselves, and kind of go from there. So the next component is just to think about yourselves. What's your size, what's your build, what's your strength level, but most importantly, what are your actual limitations? You have to be honest about those limitations. If you're not strong enough to do it, don't do it. Don't put yourself in a position to be vulnerable to create long-term damage. It certainly is not worth that. So essentially, you're in the driver's seat to make these decisions. Look in the mirror, be honest, know your limitations, get help when you can get help. Use a coordinated team approach. Make sure you call for lifting support. If you're in the ER, you're working by yourself, grab somebody else that's available to assist you. I don't want you to feel like you have to do everything by yourself. And the fact is, if your employers are putting us in positions where we have to do things by ourselves, that's not right. It needs addressed. So certainly, it's good to stand up for your own individual rights, because you have to protect yourselves ultimately. As you're delivering your instructions, just make sure they're clear and as simple as possible, that the patient is understanding, and you're delivering these instructions ahead of time before you even starting any types of movements. So safe types of movements as defined by the textbook. I didn't put every single one that they indicated here, but more of the common ones: wide base of support, Of course, avoid twisting. Make sure that your feet and your body are always moving together. Bend with your knees. If possible, keep the patient as close to your own center of gravity as possible. So, I think the big one is just to make sure that the feet and the body are always moving together, and you're not keeping your feet stationary to create this, this twerking type of twisting mechanism to our spine. So that I think that's one of the most important things. So I already mentioned the importance of a clear plan, and that definitely plays into the environment and equipment abilities. So look around, clear your space, make sure that you have appropriate lighting for both you and your patient to see. And I think that that's most important. We talked about, vision-based impairment and how that doesn't mean blindness. And if we can just turn on the overhead lights, that alone may help the patient be able to move where you need them to move a little bit easier. Know, in fact, where you're going. Don't lead yourself down the cobblestone path of, going from, cart to upright bucky, or cart to, CT table. So, be careful. Know what you're going to do. Have a plan in place, and if you have equipment available, use the equipment, including that team-based approach. So the textbook does spend a little print talking about some ergonomics, and by definition, that's just matching the task at hand with the person that's tasked to complete that. So when we think about what we're doing, think we're performing an MRI exam, nuclear medicine scan, whatever we're actually performing. Do we have a sufficient amount of space to actually maneuver easily, to be able to do cart transfers, to be able to, actually move the patient with as little bit of movements on our behalf as possible? Do we have the equipment in place? Is it easy to use? Are we properly trained on it? Is it adjustable from patient to patient to make sure that it's suitable for its purpose? Are staffing levels appropriate to make sure that we have the help that we actually need? So all of these are important figures to take into account, and yes, they do kind of match the ergonomics of the medical imaging and radiation therapy environments. Now, I've included a few review slides as far as the high points. What I really want you to do is to dig back into your textbook, though. Look over some of these reviews. I'm not going to spend a lot of time, going over these types of things, but I think it's important to just, hey, am I doing this appropriately? My hope for you is the answer is yes. If the answer is no, make sure you're making effective changes immediately. So, you don't want that damage to continue to progress. You have to be honest with yourselves that things actually may happen. So, one of the easiest techniques to use, though, is just gripping of the hands. So allow the patient to move, listen to the patient. The patient knows themselves. So, if they're saying, position me this way, they know what they're capable of. So utilize the patient as much as possible. The textbook spells out this nice process, and it's good and it makes sense, but ultimately the patient knows better than the textbook. So I would say listen to the patient first. But one thing that I really like from a sitting to standing move is that have the patient elevate their legs ahead of time, and that's just going to show you the stability of their leg strength. So if they have enough leg strength to push their legs up, that means hopefully they're going to have enough leg strength to bear weight as well. So kind of keep that in mind. I thought that was a helpful tip, but read the others kind of on your own. Now, same type of thing here with going from a standing movement to back down to a sitting based movement. You can basically see a few series of steps. Again, jump into the textbook, analyze how you compare this situation to your own. Maybe you can make some adjustments in your approach. But one thing I think that was helpful is that you should allow the patient to feel the table or bed or stretcher on the backs of their legs. That's really important because, especially for geriatric patients, that have that fear of falling, if they know that support is there, if they can physically feel that, that is going to make them feel so much more safe. So that would be another point to kind of keep in mind. Now, here are some additional tips about proper mechanisms, proper method, I guess, to sit a patient up forward. So definitely allow the patient to do as much movement as possible. One nice suggestion that the text does make is to have the patient bend their knees and push their heels into the bed, while also simultaneously having their hands on the bed to help themselves push back. So use them as much as they can. That way you can kind of save yourselves. I know that's a little bit selfish, but ultimately it could potentially be helping the patient to keep their independence as well. Could be helping the patient to make sure that they're gaining some individual strength and healing in addition. So just kind of keep those types of things in mind, that there are some actual positives that can be in place with this as well. The other thing is that the textbook does mention kind of an interesting technique, and I'm actually kind of curious as far as anyone has ever used this. Essentially, basically grabbing each other by the bicep area type of location. So one hand goes on under one of the patient's arms, and then the other hand goes on a partner's arm, type of thing. So if you've used that, let me know. I've never personally used that approach. I've never seen that approach used either. So I'm kind of curious about that. And if you haven't used it, perhaps consider trying it and then let me know how it worked out for you. Now, some other types of considerations for some everyday back care is just to make sure that you're varying your posture. We tend to get doing a certain thing a certain way, and depending on the type of position that you're currently in, you may have to remind yourselves to actually stand up for some of the day. Standing desks are becoming more and more popular if you have a management type of position. But working technologists, you are moving from area to area, more so in some modalities than other modalities. But kind of make sure that you're paying attention to your movements. In procedures like MRI exams or nuclear medicine scans that may take series of long periods of time. Just make sure that you are moving from position to position. Avoid sustained head down work. So one way to adjust kind of your workstation is to have the computer screens at eye level, rather than continuing to look down for periods of time. The most important thing is just to be aware of your posture, be aware of what you're doing, make sure you're manipulating your positions, you're not staying static. And it's because what we do at times can be largely repetitious, so it all continues to add up. So to think about proper back care, these are some tips about some adjustments that we can make. Additionally, the textbook does make specific mention that exercising is key, and I'm in full agreement that exercising is key. Kind of after some of my back injuries, I was in physical therapy for a long period of time, 6+ months, and some helped, some didn't, type of thing. You kind of form your own routine, but it's important to make sure that you continue to progress through those routines. No matter how burdensome you think they are, you can get these types of things done in 15-20 minutes type of thing. Even if you do it when you get home and you're relaxing, you're doing it between commercials on the TV set, or you're doing it with your children from for quote unquote fun. There's all kinds of different ways to focus on your back to strengthen it up. So it's not just about your back itself, but it's about strengthening your core. It's just about strengthening your whole body. So one thing that helped me personally, more than anything else, and I was actually very surprised, so that's why I'm sharing this, is that yoga I thought was an incredible tool. I've never felt as good as I did when I was doing yoga on a regular basis, and I can tell you that right now I'm not doing it as often as I would like, but something to consider, especially if you've never tried it. Really great for stretching. You know, there are different forms of yoga out there. It's not always about the Zen and the peaceful nature, but part of it can be, but the most important aspect of yoga is the relaxation and the stretching types of techniques. So I encourage you to at least look at it at some point. You don't have to go to a studio or a class to try these types of things. Just jump onto YouTube, do a couple tutorial videos, try it out, and let me know. Let me know how it works out for you. Let me know in the virtual office. I'm going to say, since you don't have a quiz this week, that your task is to try yoga. So especially if you've never tried it. So let me know if you do. So this concludes the moving and handling type of review session. The most important thing that I want you to do now is just to continue to focus on yourselves, focus on your back health, because our back has to last for the rest of our lives. So continue to work hard, do what you do, but just make sure that you're applying as many safe factors as possible. You're strengthening your backs. You're applying some of those everyday back care types of tips, and good things will hopefully be to come.